If you're watching this video, then most likely you have undergone either a breast lift or a breast reduction and ended up with breasts that are different sizes. Now, it is very normal to have different sized breasts. The vast majority of the population have one breast a little bit bigger than the other. However, if your breasts are markedly different in size, then that's something that we may be able to help you with. So if it's just a small difference, usually I recommend, everybody's a little bit different. See if you can live with it. It's probably not worth going under the knife and having surgery. But if your breasts are markedly different after having a breast lift or a reduction, then there are surgical options, and I can tell you about them in this video. But let's start by talking about the causes of why your breasts may be different sizes. Well, the first thing, and the thing that patients usually think about first, is that the doctor made a mistake. They left one breast bigger than the other. That can definitely be the case, and there are surgeons who are not very meticulous with it, and they may be a little more careless, leaving them a bit different in size. Now, when I perform breast lifts and reductions, I typically will sit you up multiple times in surgery to try to match you up as best as I can. But even by doing that, it's not going to be perfect. Sometimes there are small differences that you can't tell in surgery. Sometimes one breast may swell during surgery and the other not so much, and that can also affect the final results. So once again, I would encourage you, try to be understanding that plastic surgery and breast lifts and reductions are not perfect operations. They're not the most accurate operation we've ever performed. So there is always just that little room for some inaccuracy that unfortunately is just a part of surgery. However, if your breasts are markedly different one side to the other, then yes, it's possible that your doctor may not have taken enough time to try to match you up as evenly as possible. Weight gain and weight loss can also change the size of your breasts after having a breast lift or reduction. And this all depends on the amount of fat that is in your breasts. And the more fat you have in your breasts, the more those breasts can change size and change shape with weight gain or loss. And prior to undergoing revision surgery, it's best that you have your weight stable so that you're not undergoing these ups and downs that can alter your results. And then the final thing that can definitely cause your breast to change size is called postpartum involution. And this is a term that describes when women's breasts change size after breastfeeding or having a baby. So it's very common after breastfeeding and having a baby that your breasts will deflate afterwards. And sometimes one may deflate more than the other. Also, if your baby preferred one breast over the other, quite often that breast ends up a bit droopier and sometimes a little bit larger than the one that wasn't as preferred. And once again, this is all variable depending on the patient. So how do we treat it? Well, the first question that you need to ask yourself is, which side do you like better? Do you like the bigger side better, or do you like the smaller side better? If you like the bigger side better, then what you want to do is enlarge the small side, either using an implant or with fat grafting. Okay, so it makes sense. If you like the bigger side better, then let's make the smaller side bigger. If, however, you like the smaller side better, then we want to reduce the large side, either using liposuction or with a breast reduction. Okay, so let me repeat that. Pick the side that you like better, and then let's match the other side to it. So if you like the large side better, then let's make the smaller side bigger, either with an implant or with fat grafting. If you like the large side better, if you like the small side better, then let's make the large side smaller by either performing liposuction or a formal breast reduction. So, depending on what you're interested in, I encourage you, go to one of these two sections. Okay, so if you want to enlarge one side, then go to the section of this pre-consultation video series titled First Time Breast Surgery, Breasts Are Too Small. And I will explain to you exactly how it works to put an implant in the breast or to perform fat grafting to it. If, however, you want to make the larger side smaller, then go to the section titled First Time Breast Surgery, Breasts Are Too Large. And I'll discuss with you liposuction and breast reduction surgery in that pre-consultation video. Very important, if you're going to come in for a face-to-face consultation, I encourage you, you should bring your old records, okay? You are at higher risk since you've had previous surgery of having a complication. And having those old records can be the difference between you having a smooth operation that gets your breasts more similar in size or having a nipple actually turn black and dying. It's a big deal. So if you can, call your previous plastic surgeon, get your previous records from him or her. If that doctor does not have it, then call the surgical center where you had surgery and get the records from them. If you don't have the records, we can still proceed with the surgery, but your risks are going to be higher and your ability to control the outcome of your surgery is going to be much lower. So try to get that information and definitely bring it with you to the face-to-face consultation, because you are definitely at higher risk of a complication in general if you don't have it. So if your breasts are different sizes after undergoing a breast lift or reduction, and it's a small difference, then I encourage you to try to live with it, okay? Because the minor benefit of trying to get you a little more even in size may not be worth the potential risks. But if your breasts are considerably different in size, then take a peek at how we can match the side you don't like to the side that you do like, and bring your records to the face-to-face consultation with you. Thank you so much for watching.